Ah, being live streamed. Okay, we good?
People seeing the screen?
Yep, it's all showing that it's
Yep.
live streaming. Okay. Okay, then we'll call the meeting to order for the Community Services Board meeting for Warren and Washington County, December 2021. Let's see, first thing we would like to start with is we're going to do introductions. So what I'll do is I'll name the pictures as they show up on my screen. And if you would please unmute yourself, introduce yourself and let us know where you're hailing from. That would be great. I'll start. Kim Brayton, I'm Warren County. First one I see on my screen is Cindy Wasson.
Cindy Wasson, Warren County.
On the screen where it says live, next to live.
Hi, Cindy. Thank you. Next is James Dexter.
James Dexter, Warren County.
Oh, good, yeah.
Thank you. Belinda.
Belinda Bradley, Warren County.
Hi, Belinda.
Hi,
Next
guys.
I have Heather.
Here on YouTube.
Hi, Heather Adams Wendell, Washington County.
And then we have Tammy.
Tammy DeLorme, Washington County.
Hi, Tammy. Dean.
Dean Klickner, Warren, Washington, Rose House.
Excellent. And then Josh looks like he's talking to somebody else, but he's next on my list. Joshua.
Hello.
Hi.
Oh,
Introduce
sorry.
yourself and where you're from.
Oh, People USA.
Thank you.
Sorry.
That's okay. Hi.
Was
And then
I
we
on
have,
mute?
I'm sorry.
I hope I was on mute. I had to step aside for a minute.
You
Take a
were.
call.
You were.
Oh, okay. Sorry, everyone. It's good to see everyone. I haven't been, since COVID, I haven't been up there in a while. Got Steve Michio too.
Hi, Steve. Hi, Joshua. It's great to have you guys. Thanks for joining us.
Yeah. Proud provider of peer services, crisis respite services up there. So thanks for having us.
Thanks for being here. Next, I have Christian.
Chris Hanchett, Warren County.
Hi, Christian. Then we have Lisa.
Lisa Mead, Washington County.
Next is Adrienne.
Hey, Adrienne Slico, Northern Rivers Crisis Services.
Excellent. Thank you, Adrienne. Next one I have is LC. I don't have an image, so I'm not quite sure who it is.
That's me.
Hi.
Liz Cole with BHSN.
Hi, Liz. That's who you are. Okay. Hi. Next we have Dylan.
Can you hear me?
Yep.
Okay, Dylan Swerner, Warren County Public Defender's Office.
Excellent. Thank you, Dylan. Next we have Linda.
No.
Linda, you look like you're unmuted, but we're not hearing you. Okay, we'll come back to Linda. Next we have Paige.
Hi, Paige Lorette for Warren, Washington and Saratoga Adult Act.
Excellent. Great. Thank you for joining us. And then we got to go to Rob in the room.
Okay, Rob York, Director of Community Services, Warren and Washington Counties, and I'll go around the room here.
Crystal Mallory, Office of Community Services Secretary.
Carrie Wright, Office of Community Services, Program Analyst.
Adele Potter, Washington County. Barry Murphy, Washington County.
Eric Carlson, Office of Community Services.
Okay, that completes the room here.
Okay, let's see if we have Linda back online here. Linda, are you there?
Maybe if we can't hear Linda, if she could at least put something in the chat so we know she could hear us.
Yeah, we need to vote. I think it's Linda Michaud.
I think we've got it without her on my list. We
We're
got
okay.
Heather, Tammy, Mary Alice, Lisa,
Yeah.
and Adele.
Linda said that she did confirm that she can hear us, and it's Linda Michaud, Washington County.
Okay, so maybe when we do the votes for our business, if Linda could just put her vote into the chat.
Okay, that's a great workaround. Thank you, Rob. Okay, so we look like we have a lot of business to do, you guys, today. A lot of approval of nominations. So, but the first order of business is we have some minutes that we need to approve. First one on the agenda is the approval from the minutes for Washington County from October 14th. Heather, you want to go ahead and take that one?
Thank you. I'm trying to unmute. Yeah, so we have minutes for October 14th, 2021, meeting for the community service. Did everybody have a chance to look over the meeting notes? Okay. Is there a motion?
I'll move that.
Okay, of Tammy. Can I have a second motion?
I'll second.
Thank you. Who was that?
Adele Potter.
Okay. Is there any questions or discussions concerning the motion? All in favor say aye.
Aye.
All opposed say no. Okay. Any abstentions? Motion carried for the minutes for October 14th. Thank
You
you.
want to go ahead and continue while you guys are going that and do the November minutes for Washington County too,
I
Heather?
probably should have done them together, shouldn't I? Oh, sorry. All right. Can I, it's been a long day. Okay. Can I have approval for the minutes for November 4th, 2021 for the Community Service Board? Is there a motion?
I will.
Thank you again, Tammy. Is there a second?
I'll second again.
Adele Potter seconds again.
Okay. Any discussions on the November meeting? All in favor say aye.
Aye.
All opposed say no. Any abstentions? Motion carried.
Okay, we have a similar vote we need to do for Warren County just for the November minutes. Do I have anyone making a motion to accept the minutes? Cindy, do I have a second?
I will second that. Chris Hanchett here.
Thank you, Chris.
welcome.
Were there any changes or edits or anything like that that needed to be made to the minutes? Do they all look good to everybody?
Didn't look like it.
Great. Okay, so all in favor? Aye or hand raise, either one. Any opposed? Okay, excellent. Motion carried for Warren County. Thank you, guys. Okay, so now we got to move to new business. We have first on the docket a nomination for Warren County. Rob, you want to do the introductions?
Yep. So we have a nomination for Warren County Community Services Board for Amy Secor. Some of you may know Amy. She works for the Warren County Probation Department. She's been very involved in a lot of the youth initiatives and coalitions. Some of Linda Wright's is our Children and Youth SPOA coordinator, and she has worked closely with Linda on some of the youth initiatives. And she's currently working on an initiative in Warren County. It's called Y Reconnects. And we're going to arrange to have her do a presentation early in 2022. It's kind of a cross systems initiative that she'll be presenting on. And but I just thought with all of her involvement with our some of our groups and her interest in serving youth, that she would be a good board member. And she's agreed to serve.
That's excellent. So we need to vote on that, yes?
Yes.
Okay, so do I have any questions for Rob before we go ahead and make any motions to accept her onto the board? No questions, no concerns. Excellent. Do I have someone willing to make a motion?
I'll
Belinda?
make that motion.
And Christian, you want to second it?
I will second it. Yes. Thank you.
Excellent. Very good. Thank you.
Who's the first?
First one is Belinda. Okay, so if there's no discussion or questions, all in favor, hand raise or aye. Jem, you're shaking your head. That's an aye? Okay. Any opposed? I don't see any opposition, so motion carried, and we would like to welcome Amy to the board.
Yeah, I could just make a comment about Amy, knowing her for many years and working with her for many years, that she will be an excellent addition to this board. So I know that James, you know her as well through the Warren County interagency collaboration board too. So should be great.
Absolutely. She'll be an outstanding addition.
Yeah,
That's
thank
great.
you, Rob, for bringing her on.
Yeah, and just to be clear, what we, at our board level, we approve the nomination, and then that goes forward to the Board of Supervisors for official appointment. So they're the ones that do the actual appointment.
Good point. Thank you, Rob. Excellent. Well, that's great to hear too. Thank you, Christian, for sharing how you're familiar with her. Appreciate that. Next new business is Washington County. They also have some nominations, so I'll turn it over to Rob.
Yep, so just quickly, 2 additions to the nominations for additions to the Washington County Community Service Board. Lieutenant Kristen Hardy currently works for the Washington County Sheriff's Office. She's been involved in a number of our criminal justice task force, and was instrumental in developing the overdose dashboard that is available for Washington County, and just has a real interest in the addictions area and some of the areas that we cover. So she has agreed to serve, and I thought it would be nice to have a perspective from law enforcement as well. A number of the initiatives going on now, including police reform and development of crisis services. Be good to have a voice from law enforcement. And then Sue Mowry is the Assistant Director of the Washington County Youth Bureau. And again, she's someone also who's been very involved in our subcommittee and worked with Linda Wright. And also she has that unique perspective of being the Assistant Director of both the Youth Bureau for Youth Services, and then also alternative sentencing in Washington County, which deals with adults and criminal justice issues. So
Great. So is it okay at this time? Can I do them together as the vote?
Yes.
Okay. So for Christian Hardy and Sue Mowry, can I have a motion?
I'm not working on commission, but I certainly will make that motion.
All right. Is there a second?
Mary Murphy seconds in the room here.
Okay. Any discussion, any further, do you have any further questions concerning either one of these, possible people coming on to our board? Okay. All in favor, say aye.
Aye.
All opposed, say no. Motion carried.
Okay, I'll keep things moving right along. We have a request for Warren County for a 2021 budget amendment. This is for $12,675. This is 100% state aid from the New York State Office of Mental Health, designated for Behavioral Health Services North. So we need to have a vote to amend the approval of amending the budget to accept those funds and pass them through.
Is that in the packet, Rob?
It should be in the packet, yes. That should be the next item after Sue Mowry's resolution data form. It should say at the top, resolution request form number 7.
Oh, there it is. Okay.
Sorry, these are the forms that the county uses, so I just copied them.
And pass through state aid. Okay, so that's just for Warren County or Warren and Washington, Rob?
This one is just for Warren.
Okay. So any questions for Rob about the resolution? Concerns, issues? We'll take more money. That's always good.
They were awarded some what was called VAP money. It's Vital Access Provider. It was some additional funding in recognition of them taking over the services from the hospital, and that there were additional costs related to that. And then also there was some COLA funds. And so just together, we needed to raise their contract ceiling to allow for acceptance of all the state aid.
That's great. Okay. Do I have a motion from Warren County to accept the resolution? Cindy, do I have a second?
I'll second that.
I think Belinda beat you, Chris.
Okay. I'll let her slide in.
Okay. Okay. So is there any discussion on one more offer? None? Okay, all in favor? Aye or hand wave? Excellent. Okay, any opposed? Anybody have to abstain? Okay, all motion carry for Warren County.
Okay, similarly, I need a vote on a request to amend the Washington County budget. And this is to allow for acceptance and pass through of state aid, $12,920 from OMH and $7,740 from OASIS. These are COLA funds for various agencies.
I'll make a motion.
All right. Oh, thank you. Wasn't sure if he was finished talking, so I was waiting. Is there a motion? Thank you. Is there a second motion?
Sure.
Mary Murphy, second.
Any discussions? All in favor, say aye.
Aye.
All opposed, say no. Motion carried.
Okay, now we'll thank you, everyone. We'll turn things over to Liz Cole, who's joined us to do a presentation and talk a little bit about some agency updates, but also particularly talk about a recent Samsa grant that they received. This is federal funding. Samsa is a federal agency, and they received a significant Samsa grant. I believe it's focused on primarily on crisis services, but I'll let Liz fill us in.
Hi, thanks, Rob. So really excited to share that we went for a grant last year to expand our crisis services across the region of Clinton County, Essex County, Warren, and Washington. And we did receive that. Primarily, this grant is going to focus on us building out our crisis residential program within Clinton County, which is going to allow us to build 2 crisis residences, one for children and one for adults. The idea behind this program is that there will be a place for our clients who will hopefully be able to deter them from the hospital. So deter them from going to the ER and sitting and waiting and potentially going on the unit, or sitting and waiting and going home. And also on the opposite to where they do go through the MHU and they're coming out, and instead of going from 24/7 crisis support, instead of going from 24/7 support and then going back into the community and expected to present for their outpatient follow-up. This would be kind of a transitional step in that if they are not 100% ready to be transferring back into the community. So we're really excited about that. This has been something we have been trying to find a solution for many years. There's not a lot of day programs. The funding for day programs really aren't there. And this is kind of the closest thing we can kind of get to it on the crisis side. So we're very excited about this. This will also, there'll be access for the Warren and Washington. I mean, really anywhere in the state can come, but having the ability to transfer our clients right from the organization into the crisis residential as needed will be important. We're starting out with 6 beds on the adult side and 3 on the children's side. We know that we probably need 10 times that amount, but that's going to be where we start and really go from there. The other part of the grant is going to be focused on a platform, an app that we're going to be utilizing so that people can access crisis services at their fingertips, and they would have an online support available 24/7 to reach a clinician. We do provide 24/7 crisis 7 days a week, and part of that will be giving the access point through the technology front, what we're kind of calling the front door, to services. Along the same lines, we'll be building out the 24/7 crisis support in the Warren and Washington area as well. So we're really excited about it. We had, before the pandemic started to push on the crisis residential side, we had identified 2 buildings, but the way that the rate structure, of course, wasn't necessarily sustainable. So this grant is going to allow us to be able to do that in a way that will be sustainable, and hopefully will continue in the future to have some of the crisis funding to support the build and the growth and expansion of it. So that's kind of the grant in a nutshell. We are hoping for a spring start for our residential homes. And after we get kind of launched in the Plattsburgh side, we will be assessing the needs on the Warren and Washington side to see if that is a program that should be replicated and built in, and to explore the funding and process for that as well. On an agency update front, feels like we've been there for 10 years, although we just celebrated our year mark, which was a wild year, but we're really excited. We have been able to get our wait list down. I think we're about down to 50, and that was from 500. So a significant amount of efforts from our amazing team, from all the way from customer experience to care coordination, our clinicians and our providers. So we're really thrilled about that. We are continuing to kind of expand some of our office space to prepare for the needs that we know will continue to grow through the pandemic. And now going into our second year, we're going to explore what gaps of services there are for other programs that maybe are not existing in the area that we have been doing on our side. So a little bit of an update on that. Any questions for me?
Quick question about the app that you're talking about putting in.
Yep.
Is that a crisis app that's primarily for folks that are enrolled in your agency as clients, or is it kind of more general, widespread area kind of an app?
So it will be, of course, for the people that are admitted into the organization, but anyone in the area will have access to it. Just like right now, we cover crisis support for many providers within our area in the Plattsburgh area. So if I called or you called, you could get crisis support at 2 o'clock in the morning.
Thank you.
Yep. Anything else?
Good job on getting that wait list down. That was great.
It's been wild. We have hired some really amazing clinicians. We have started, I don't know if Tia or Jen gave the update, we have started to open access. So we're moving people right in as they're coming in and asking for help. And that's a big part of getting people moving is when they're ready and able, you want to move them because they might not be ready tomorrow or 3 days later. So that has been a big help in getting people who are identifying the need and moving them through treatment.
Great.
I did have an encouraging interaction this week. I was involved in via a telephone with somebody who was experiencing a crisis, and they had been referred to contact BHSN. And he told me that he had an appointment that day, was given an appointment that day to be seen, within a couple of hours, and had a follow-up appointment either the following day or day after. And so he was very, very encouraged to be able to access those services so quickly. So that was just a personal, experience that I had where somebody was able to get those access to those.
That's wonderful. That's great to hear. I also just kind of reviewing on the crisis side with our crisis director that's here. She had a couple of great interactions with the law enforcement on the Warren and Washington side, and was able to connect and do welfare checks, and just was really, really impressed with the way that things were managed. So I think we're building some really great relationships that's ultimately going to benefit, our clients the most. So we're excited.
Great. Okay, any questions for Liz? I know she has to hop off here in a moment.
I'll continue, Rob, as we kind of move through the grant and the implementation. I will continue to kind of build that into my update, or whoever does present at the time, to kind of let you guys know where we're at. We are really excited to have this residential option for a crisis, because we know the hospital isn't necessarily the place that's going to be able to kind of cover all of the crisis needs. So we're hoping it will help with the transition back into the community, and having it be easier and smoother, and keeping our clients stabilized. So more to come, and hopefully some great outcomes from it.
Great, thank you.
Thanks so much.
Okay.
Rob, we have Linda Wright up next.
Want me to keep moving? So what we're going to do, Linda has asked to defer her presentation to future meetings. She had some things going on here this afternoon with some individuals, crisis type situations that she's dealing with. So we're going to push that presentation off until the first of the year. Yeah.
Great, excellent. Okay, so then that moves us to the additional information items.
Okay, so in your packet, you should have a couple of tables. One for Warren County, one for Washington. This shows our psychiatric expenses related to competency restoration. So when the courts within a county have someone who's a felony level offender, who there are questions raised about their competency, they're ordered to have examinations to assess that competency. The examinations have to be conducted by has to be two separate evaluations, examinations. Sometimes there's a need for a third if the two don't agree and the court would like to have a third. And so we pay out of this line, we pay not only for those exams, which are paid at $175 an hour to local psychologists, including Kim is one of our psychologist evaluators. And we have a few others that we work with. If a felony level offender is found to be not competent, they are hospitalized at a state facility for restoration services to restore that competency so that they can come back and face their charges. So the charge back from the state for those hospitalizations and restoration services is a little over $1,000 a day. So it's a significant expense to the counties. We can't use state aid against it, so it's 100% county dollars. And it's one of those things that we have very little control over. You know, how many people are just going to happen to come through the court system and fit those specific criteria. Now, if you're a misdemeanor level and you're found to be not competent, then you're sent to a state facility also, but it's a civil commitment. So they go to, let's say it would be Capital District Psychiatric Center. And they really are just assessing whether the person is a danger to themselves and needs to be held at the hospital, like an immediate danger, or whether they can be released. And so usually those are very quick turnarounds. People are usually not at that point deemed to be in immediate need of hospitalization. So that's what happens on the misdemeanor side. But on the felony side, that's where we incur these expenses. So I just wanted to go over that to keep the board apprised that for Warren County, you can see in the table that they had budgeted $25,000 in this line. We received some bills in the first half of the year. We didn't have any expenses. And then toward the second half of the year, we started seeing some bills coming in. The other thing that's a bit complicated about this is there's a significant billing lag from the state. So for instance, we just received today our September bills. And so it takes a little bit of research and working with OMH, the jails, the hospital, state hospital, to try to keep track of these expenses so that we can make budgetary moves timely. because we won't see the December bills until after the new year. So anyway, we determined through some investigation that through our October, we had incurred some significant expenses and needed to make some budget moves. So in October, we did some transfers of $9,800 within our departmental budget. And then we got permission from the county to do an appropriation from the fund balance of $110,000. So that brought us up to 144. Then you can see on the expense side, we had the restoration expenses of 187,656, and the examinations January through November were 7,875, and the an estimate for December of an additional 650 brought us to 196,181. So that left us with a negative balance there, 51,381. So I did go to committee this past month to get this before the Board of Supervisors for December. And they're going to transfer an additional $75,000 just in case there are any additional hospitalizations that occur during the month of December. So pretty significant expenses that are hard to budget for. On the Washington County side, we've had a number of years where we've had to move funding to cover this. So they decided to bump their initial budget line up. So they initially budgeted $100,000 in January of 2021. But then through first half of the year, no expenses. But then during the summer and into the fall, experienced expenses of $145,475. The examinations through October for Washington County were $42,75, and then an estimate for December left us at $150,605. Again, a deficit of $50,605. And Washington County takes a little bit different approach. They wanted to wait because they can still amend the 2021 budget once they get into 2022. And so they want to wait and see the actual December bill so that we know the exact total so that they don't have to make multiple moves. So it's really just informational one to keep folks apprised of these expenses. Any questions or?
Thank you, Rob, for the fine details on that.
Well, it's just one of those things because it is such a significant outlier type of thing that something you might hear about or, you know, be approached about. So I wanted you to be aware of it.
Hey, Rob, just one question. I assume the information that the statute that allows somebody to not only be judged incompetent, but also the rule to go to this facility is a state statute, I'm guessing. And is it in the county budget because the county has the local jail, or what? Why does I'm just trying to figure out the logic of why the counties incur these expenses.
Yeah, so it used to be, so it's criminal procedure law. It is state law. It's New York State Criminal Procedure Law, Section 730. It used to specify, it used to be a shared expense between the counties and the state. It was 50-50. But the state changed that a year or 2 years ago to make it 100% county expense. So I mean, why is it? Because the state made it, put it on the counties.
I thought that might be the answer, but it's just, it's very unfortunate when certain politicians talk about how their budgets are coming in better than everyone else's, and then they say, but you're going to take out expenses. But
it's almost like an unfunded mandate in a roundabout way. It's like you have to do this, but we're not going to help you fund it anymore.
Yep.
We've seen that in other areas too, and I'm sure that you know, the school systems are aware of some of the things that have come up where they've had expenses increased immensely in regards to certain special education programs. where children who might have to be going to day programs, it's just super expensive. Not too long ago, they changed the rates that schools and counties had to split. So it's one of those things.
There's a significant amount of advocacy going on, both by our statewide association and also NISAC, which is the New York State Association of Counties, advocating that the state, return to sharing some of the expenses. There's also a number of efforts of looking at, is there a different way to do this? Some states have, like, for instance, outpatient restoration, or some states do the restoration right in the jail, and could we develop local or regional restoration type of programs? Those things are being explored, but nothing firm on that or advancing too far yet.
The other thing, Rob, that I wanted to kind of bring up too is I wonder too, if particularly as long as it continues to be all on the county, and I assume my guess is Carrie's already tracking this, but tracking like longitudinally what we're looking at, because I think it also provides some opportunities to look for, maybe training opportunities with judges in terms of what, to really look for, particularly for new judges sitting on the bench and things like that, because I think that kind of plays into understanding when this is really appropriate and not appropriate to be asking for.
Yeah. And it's really a small slice of the total number of people who are ordered for the evals. I mean, first of all, you take it's only the felony population that incurs these expenses, significant expenses. And then beyond that, it's only those that are found to be not competent. So we're really just talking about 3 or 4 people that incur these large sums of. Yeah. Okay. All right, I'll keep moving on the additional information items. Next, we have the Adirondack Peer-to-Peer Veteran Support Program. This was an RFP that was issued by Warren County in, I believe, in November. They had their opening on December 2nd. Pleased to report that we had 3 responses, so we do have some opportunity for, comparison of proposals and selecting an entity to take over operation and promotion of this program. So we had the Adirondack Vets House in Glens Falls was one of the applicants. People USA was an applicant, and SUNY Adirondack is an applicant. So we have the 3 applications. In terms of process, the RFP specified that there would be a selection committee. It would be comprised of myself, the directors of the county veterans service offices. So in Warren County, that's Denise DeResta, and in Washington County, that's Ken Winchell. We also will have representatives from the Community Services Board. Cindy Wasson was willing to participate in that. Cindy's a veteran, and Amy Malloy had offered. I'm not sure if Amy's going to end up still being a part of that or not. And then we had also specified that some local elected officials, appropriate elected officials might be involved. And so that would involve probably either chairs of our county committees and/or chairs of the Board of Supervisors. So that group will be convening and working on its process for selection. I'll keep the boards apprised, and we probably would be looking at I would think the February meeting, maybe something coming before the CSPs for approval to forward on and get, county level approval. Okay, then the OMH grant for peer diversion services. I do see that Josh and some representatives from people are on. I don't know if Steve is still there with Josh, but Josh, is this something you wanted to speak to? It looks like we were contacted by the Office of Mental Health. There were certain counties that had a high occurrence of arrest of individuals with serious mental illness. And so the Office of Mental Health was reaching out to those counties, offering a funding opportunity to develop some diversion services. And we were aware of People USA providing a peer diversion service in the lower part of our region, and had heard very good things about it. So we approached people to see if they might have an interest. They did. They submitted a proposal to us, and we forwarded that on to the Office of Mental Health. Office of Mental Health would be funding them directly, so it would be a direct contract, state contract between New York State and People. But they just want our guidance and blessing on it. And so, Josh, are you available to say anything about that, or?
Yeah, sure. So we got a funding stream from, originally it was from the feds, and then it sort of transitioned into OMH's forensic unit down in Westchester County. So all the way at the very bottom of the Hudson River region, to create a forensic mobile team, which does crisis response and does what I would probably call transitional care management to people at the highest risk of entering the criminal justice system due to underaddressed mental health or addiction issues. So we've been quite successful in that program with an over 90% jail diversion rate for a population that has traditionally been in and out of jail. So we're very excited to kind of reproduce some of those successes up in the Warren and Washington area, and to make sure that, as the state has downsized long-term care facilities over the last 65 years or so, we want to make sure that we focus our advocacy on making sure that people with mental health issues or addiction issues aren't just ending up in the new hospitals that are, incarceration settings, whether that's jail or prison. So yeah, we look forward to working very closely with the Office of Community Services, probation, the existing police crisis intervention teams that have started to form up there, which we are also working to get more training. I believe that was part of it as well, training more police and how to recognize mental health issues or addiction issues and divert people to the appropriate services. So we're going to need everyone in the community on board to make this specific population a very high priority when the needs arise.
So Josh, thank you for mentioning the CIT. Yes, that is part of the funding will allow us. Carrie, do you remember how many rounds of CIT? I think it's three. Carrie believes 3 rounds of CIT will be funded with this pot of money as well. Yeah. And for our board members, you'll probably be hearing a lot over the next year about crisis services. New York State is trying to redesign their crisis system and try to de-silo the crisis system a bit. So we have different agencies trying to work together so they don't all have separate crisis response systems. There's a recognition with police reform efforts and law enforcement efforts that there's significant partners in this, and that these two things really go hand in hand. That our crisis system and they're being first responders. And so they're just really taking a look at how can all of this come together. You'll be hearing more as we go on through the year, I think, of 2022 about crisis and crisis redesign. The other thing that's coming I think it's in the late spring, early summer of 2022 is 988, which would be a direct line, just similar to 911. People could call 988 for mental health crisis and support. And so, we'll be talking about that more as we get into 2022, but everybody's focused on, developing that as well. That's a national initiative, not just New York State, but New York State has to implement it. And then obviously, when we say the state has to implement it, we have to have local coordination and development for that as well. So any questions for Josh or anyone here? Josh, I really appreciate you getting on today and helping to describe this. Thank you for all your work on it.
Oh, thanks. Yeah, we're very excited. It's again, it's a big advocacy issue of our time, is making sure that we're not substituting the old state-run hospitals for jails. And so we're happy to be on that front line and working with everyone that we already work with in the community.
And it's really a significant and potentially, so impactful to have a peer to reach out in crisis, and to be there. And then not only just at the moment of crisis, but the proposal includes, follow up with them, working with them if they do end up in the criminal justice system or in some process related to that. So it's a really sound proposal. I have high hopes for it. Thank you. Okay, keep moving on. Then I have the 2022 county budget updates. There's really not much to say there. Both counties have adopted their 2022 budgets, pretty much in line with what we submitted. And, I appreciate the work of the Budget Review Committee this past summer in establishing the contract levels for the agencies. And that's all, kind of wrapped up with our admin budget and gets submitted. That's what gets approved for our department in the county budgets. Then we did include in the packet a 2022 Community Services Board meeting calendar. So that's a calendar of our board meetings and then the subcommittee meetings as well. At least for the first part of the year, we'll continue to be meeting by Zoom. We'll have to keep an eye and see what's happening with the COVID numbers. If at some point we hope to be able to be back to in-person meetings or more of a hybrid type meeting. Also, just wanted to note that there's a handout in the packet of the proposed composition of the standing committees and subcommittees for the community services boards. We usually ask people to be part of at least one standing committee and at least one subcommittee based on sort of your level of expertise or interest. And pretty much carry things forward from year to year. If anybody has a particular interest in changing something, just let me know. Well, this will be voted on at the organizational meeting in January. And again, we recognize that even though someone might be assigned or attached to a particular subcommittee, that people who, the board has various levels of ability to participate in those, at that level. And that's perfectly fine. People that some people make every meeting, some people can't make any of the meetings, and that's fine. They follow along with the notes and that sort of thing, minutes. So that's pretty much all I had. I know we're going to finish early today because we didn't have Linda's presentation. I did want to include and take time to recognize all the board members for your contributions through the year, and to just wish everyone happy holiday season, and to thank you again for the work we do. It does make a big difference in the community.
And let us take this opportunity to thank you, Rob, for all the work that you do. You do so much of the organization around all of this, and you keep things running at a really lovely pace, and you address issues that really need to be addressed in our counties, and we really appreciate you.
And I guess I would also have to say really recognition to the staff as well. I mean,
absolutely. Thank you to the entire staff.
Yes, thank you.
Yeah,
So much
you all
of-
do a great job.
Thank you. Okay, so our next is scheduled for January the 13th on Thursday in January. Will also be by Zoom. And we will start the meeting with our 2022 organizational meetings before we open the first regular meeting of the Community Services Boards. So with that, I hope everyone does have happy holidays and safe holidays, safe travels if you're traveling. And we'll reconvene in January.
Thank you.
Happy
Rob.
holidays,
Holidays,
everyone.
everyone.
Holidays.
Stay healthy and have a nice holiday, everyone.
Bye.
Stay
Yes.
well.
Thanks for everything, Ron.
Thank you.